Well, good afternoon, everyone, and it really is a good afternoon. This is a happy day for Alberta. I am very happy to be here with Health Minister Tyler Shandro for some fantastic news for all Albertans. Yesterday, Alberta officially surpassed the 70% vaccination threshold to trigger stage 3 of Alberta's Open for Summer plan, with 70.2% of eligible Albertans receiving their first vaccine dose. And that means that on July the 1st, on Canada Day, Alberta's public health measures will be lifted and our lives will get back to normal. Since last spring, I've been saying that Albertans should expect since this spring, I've been saying that Albertans should expect a great Alberta summer. Maybe even the best summer ever, given all that we've been through the past 16 grueling months. And that's because I never doubted Albertans. I never doubted that we would reach this milestone together, that we'd pull together as a province, as a people, and get her done in the true Alberta spirit. So today, I want to say, we did it. You did it. And let me say this, thank you. Thank you to the healthcare workers who have worked tirelessly to get needles into arms since December, when that first batch of doses arrived on a cold winter day in Calgary. Thank you to Alberta Health Services for designing and executing a brilliant country-leading rollout strategy that has led Canada in safety and efficiency. But most of all, thank you to the 2.7 million Albertans who have chosen to roll up their sleeves and get the jab. Because of you, we're about to take this huge step forward. In a moment, Minister Shandro will share details on stage 3 and what Albertans need to know about the next steps. But here's the bottom line. On Canada Day, virtually all remaining COVID-19 restrictions will be history. No more limits on weddings or funerals. No more bans on indoor social gatherings. No more limits for gyms, sports, and fitness activities. No more capacity limits at restaurants, in retail, or for places of worship. No more advisories against non-essential travel, so long as you observe travel requirements in other jurisdictions. Instead, we'll get back to doing the things that we all love, the things that make summer in Alberta so special. Backyard barbecues, camping with friends, visiting our parents and grandparents, festivals, movies, and concerts, watching the Stampedes and Elks at McMahon and Commonwealth Stadiums with a cold beer in hand, and yes, the Calgary Stampede. And how awesome it'll be that we open up fully on Canada Day, the day we celebrate the freedoms that we all cherish, that we welcome back fully into our lives, all the freedoms that have been limited at times over the past 16 tough months to help save lives. So now we still have to follow common sense, and that means staying home if you're sick, getting tested if you have symptoms, and for those who test positive for COVID-19, they will still be legally required to isolate. And we'll still ask people to use good judgment. Keep the good hygiene habits that we've all learned through the pandemic, because COVID does continue to circulate, and it likely will for years to come. So we just need to use common sense and exercise personal responsibility. Because COVID may particularly pose a threat to the unvaccinated. Effectively, we are now moving, on July 1st, I should say, moving from mandatory government restrictions to vaccines as our best way of protecting lives from this disease. But everyone should continue to exercise personal responsibility, as I say, common sense, after we reach phase 3 and full openness on Canada Day. Thanks to vaccines and the millions of Albertans who have been protected by them, we finally have the upper hand on this virus and can safely open up our province. At 2,471, our active cases right now are the lowest they've been since the beginning of October, and they've declined by 61% since we started stage 1 of reopening back on the 1st of June, less than 3 weeks ago. The number of people in hospital has dropped by 45% over that same time, and ICU admissions have fallen by 53%. Our 7-day average for new hospitalizations is only 12 cases, the lowest it's been again since October. And the 7-day average for testing positivity rate is just below 3%, the lowest since October 21st. I don't have a final number, but I understand that we'll be reporting yesterday's new cases at just around 100, one of the lowest levels in months. This is amazing progress, and it's a testament to both the vaccines, which are a miracle of modern medicine, and the efforts of millions of Albertans. And for those who are still holding back on the vaccines, let me remind you, your vaccine shot is also your shot at $1 million, and it helps to protect your life, the lives of your loved ones, and the safety of our whole community. We have administered well over 3 million doses and only recorded about 570 adverse health outcomes, most of them minor, which means that these vaccines in Alberta have proven to be 99.99% safe. Now, let me be clear. We won't stop. We'll keep ramping up our vaccine rollout because we don't just want to be open for summer, we want to be open for good. That means speeding up second doses, which Minister Shandro will share some great news about in a second, and it means sparing no effort or expense to ensure that as many Albertans are as fully vaccinated as possible over the summer months. So enter the Open for Summer lottery. As of this morning, more than 1.3 million Albertans have entered for their chance to win $1 million and other great prizes, more to be announced later this week. Since we hit 70% yesterday, the deadline to enter your name in the lottery is 11:59 p.m. on Thursday, June 24th. So if you haven't gotten that first dose, or you'll receive it before then, go to alberta.ca/lottery to enter your name. And I can tell you, the data is still a bit early, but we can see a very definite uptick in first dose demand and bookings since we announced the lottery. So it seems to be working to get the attention of folks who just hadn't gotten around to getting the jab. And a friendly reminder that proof of vaccination will be required, of course, to claim the prize should your name be pulled. But we said from the beginning that while one dose offers enormous protection, and let me just pause there to say the Public Health England study released this week shows that the first dose of an mRNA vaccine like Moderna or Pfizer is 96% protective against hospitalization against the so-called Delta variant. So these things work in a huge way. One dose is really important, but 2 doses really locks in that immunity. And that's exactly why 2 out of $3 million giveaways in the Open for Summer lottery will go to second dose recipients. At nearly 26% of the eligible population fully vaccinated, having gotten their second dose, Alberta is leading Canada when it comes to second dose uptake and administration. Well done, Albertans. But we don't want to leave anything to chance or to fate. First doses have been our ticket out of this pandemic, but second doses will make sure that there's no return journey into it. The sun is rising in Alberta. This is our time, the start of an exciting recovery for our province, of an Alberta Renaissance. Couples who have been putting off their weddings for over a year can now plan for a memorable celebration. Small business owners are reopening their doors and hiring new staff. Fitness instructors are moving back into their studios. Zoom-weary employees are heading back to their offices, and people of faith are returning to their congregations, worshiping and fellowshipping together. With vaccines working their magic and thousands more Albertans rolling up their sleeves, in fact, I'm headed from this to get my second dose at the Edmonton Expo Center. With all of that happening, the end of this terrible time is just 2 weeks away. I know it's, for some of us, hard to believe, but it's true. Until then, though, we ask that everyone goes the last mile together by observing the Stage 2 public health measures that do continue to be in effect. And I just need to underscore that. We've been doing this last part of our approach to the pandemic carefully and cautiously, crushing that spring spike, getting those numbers down as low as possible so that the vaccines could beat the variants in the race. And that's why we've got to have a couple more weeks of caution with the existing rules. Stage 3 starts on Canada Day, and we've never been more ready. So mark it on the calendar, folks. On July the 1st, Alberta isn't just open for summer, but I believe will be open for good. And with that, I'm going to invite Minister Shandro with another exciting announcement.
That's right, there is good reason for applause. Thank you. Well, thank you, Premier, and indeed it is a great day for Alberta. We're now just 2 weeks away from stage 3, and as of right now, we're rolling out second doses to even more Albertans. Hitting that 70% milestone was made possible by the efforts of many, many people. Now, back in December, we knew that rolling out this vaccine would be an incredibly big job. But we also knew that our health system here in Alberta is staffed by the best people anywhere. And I want to thank every single person who has helped to protect Albertans at our immunization clinics, at our community pharmacies, at our physicians' offices around the province. Each of you who are involved in this rollout, each of you helped us to be able to get to this point. And each of you is helping us to get out of this pandemic. So thank you. And now we're getting ready for what comes next, a return to a free, open province. When we enter stage 3 for our Open for Summer plan on July 1st, we'll say goodbye to the many province-wide mandatory restrictions that were necessary to manage the spread of COVID-19 over the last 16 months. And as Premier noted, we'll once again be able to have indoor gatherings in our homes. And there'll be no more capacity limits on restaurants, retail businesses, places of worship and other settings. Life will, in most ways, go back to normal. However, there are still going to be some rules and best practices in place. This is essential as COVID-19 is still here in Alberta as around the world, and new variants will likely continue to emerge. A great example will be that there will still be isolation requirements for a confirmed case of COVID-19. And this is going to help our contact tracing to reduce transmission and keep small outbreaks from growing. Remember, contact tracing has always been a basic function of public health for communicable diseases, for example, like tuberculosis. The pandemic has brought a focus on those amazing folks in our healthcare system to be able to help us with responding to public health concerns like COVID-19. But we started the pandemic with 50 of these folks. They've always been an important part of public health. Now, COVID will continue to be something we have to manage, something we have to respond to, like any other communicable infection. But that's the point. We're transitioning from a pandemic that changes everything about how we live to a virus that we control with vaccinations and learn to live with, like other infectious diseases and other health problems. There will also be some protective measures in our continuing care system to be able to protect our most vulnerable Albertans, and masking may still be required in limited and specific settings. Common sense basics will also still apply. Wash your hands, stay home if you're sick, get tested if you have symptoms. And our health teams are working hard on all of the recommendations, and more details will be posted online prior to the start of stage 3. And as Dr. Hinshaw has said, COVID-19 is still here. It's still a threat. The key to living with it is controlling it through vaccinations. And as Premier alluded to, second doses are critical. And that's why I'm so pleased to announce that all Albertans who received their first dose in May can book a second dose starting right now. And that is 11 days earlier than what we had originally planned. Thanks to the improved vaccine supply from the federal government, we're now able to get second doses into the arms even faster. And I'm also pleased to announce that if you got a first dose in June, you can book your second dose appointment as soon as 4 weeks have passed since your first dose. That means that if you got your first dose on June 1st, you can book your second dose on June 29th. Now, going forward, if a first dose with a messenger RNA vaccine, you only need to wait 4 weeks to book your second dose. If your first dose was AstraZeneca, like mine, we recommend that you wait at least 8 weeks for your second dose to ensure maximum protection. And I want to emphasize that's not because of any concern about the AstraZeneca vaccine or because of supply or anything else. It's because it actually works better if you give it a little longer between those doses, like Dr. Hinshaw and I had done, and Premier as well, because Premier's, your first dose was AstraZeneca as well. And if you had AstraZeneca as your first dose, it's still your choice which vaccine you get on your second dose. If you have questions, make sure you talk to a healthcare professional. There are differences, but all of the approved vaccines are safe. All of them are effective. You also have a choice between the two messenger RNA vaccines, Pfizer and Moderna. But they're closely equivalent in the way that they work, so please consider getting whichever one of them is the first available to you. These are interchangeable, these two messenger RNA vaccines. There are now 1.1 million more Albertans eligible for second doses, so it will take time to get to everybody. Please be patient. No one is going to be left behind. And remember, this latest news on second doses does not mean first doses are over. You can still get a first dose. It's the right thing to do. For anyone listening, for anyone who hasn't had their first dose yet, we are still doing first doses. We still need you to step forward and get those first doses into your arms. And when we started this vaccine rollout, there was only a very small supply of doses that we were getting into Alberta. So we had to be very specific about who could get them and when. But those rules are all gone now. The process is simple. If more than 4 weeks have passed since your first dose, you can book your second if that first dose was a messenger RNA. If you got AstraZeneca as a first dose, wait 8 weeks and then book your second dose either with a messenger RNA vaccine or another shot of AstraZeneca. That's your choice. If you haven't had a first dose, again, please book it now. You'll not only protect yourself. This isn't about protecting yourself. This is about being able to protect all the vulnerable people around you. But also, now another incentive, you'll also be able to enter the Open for Summer lottery. Registration for the first draw closes just before midnight on June 24th. And speaking of which, we've heard from snowbirds and others wondering if they're eligible for the lottery if they received one or both doses outside of the province. The answer is yes. You are eligible. And starting today, AHS is offering a fast and easy way to add your out-of-province or out-of-country COVID-19 immunization to your health records. You can now submit your information through a new, secure, web-based portal. The website is ahs.ca vaccine registry, where vaccine registry is all one word. So ahs.ca vaccine registry. And you can fill out information for yourself or your children if they're under 18. AHS is going to review the submitted records to ensure that you received an acceptable vaccine at an appropriate interval. If approved, it'll be added to your permanent health record. So please be patient at this process. It will take 2 to 3 weeks from when you submit your records for it to be able to show up in either Netcare or your access as a patient, which is through My Health Records. And this is going to ensure that you have accurate personal records and that we have up-to-date data on how many Albertans have been vaccinated. And it also serves as proof of vaccination for the Open for Summer lottery. And again, the first draw is just around the corner, and 2 more draws for cash and other prizes will follow later this summer. Thank you, and we're happy to take any questions. Sorry, you're right. There is more. There is more to be done before we take questions.
And then we can return to the podium for Q&A. So we will do 2 questions each today as per usual, and we'll start with 2 on site and then I'll take 1 from the phone. So Janet, go ahead.
Hi, this is a question for the Premier. It's Janet French from CBC. So one of your key social studies advisors on the draft curriculum has recently written that media and people on social media are overreacting to the discovery of unmarked graves of children in Kamloops, the residential school. He says that the degree of harm perpetuated on Indigenous people by residential schools is incomparable to what the Germans did to the Jews in the Second World War. And he said that activists are exploiting the discovery of these children's remains to paint Canada as a racist country. Do you share Chris Champion's views of this, and why or why not?
So that individual has not worked on curriculum since October of last year when his contract ended. I don't agree with many of his views. I do think that we need to not confuse the historical singularity of the Holocaust of the Jewish people, which has a historical and moral character which is truly unique in all of human history. The deliberate and industrial killing of 6 million European Jews in an effort to completely exterminate an entire race as the explicit policy of a fascist government. That is, as somebody who led Canada's Holocaust education, commemoration and education efforts for several years as the federal minister for multiculturalism, and who led Canada's application in its accession to the International Task Force on Holocaust Education, Commemoration and Research, I learned very clearly from the Jewish community, from global scholars, that we, I think, must always acknowledge the unique and singular nature of the Holocaust. I don't think it's generally helpful in public debates to diminish the unique horror of the Holocaust with historical analogies. Now, having said that, I've been absolutely clear about the gross injustice, the wickedness of the Indian residential school system in Canada. I spoke to this in the legislature recently. The state abusing its authority to effectively steal children from their parents, to sometimes physically beat their culture and language out of them, to often live in substandard and sometimes dangerous conditions, the deplorably high fatality rate of Indigenous children at those schools. The entire system is a terrible black mark on Canadian history, which is why I think it was appropriate for Prime Minister Harper to offer the official apology to Indigenous people for the entire system, to provide billions of dollars of financial redress and compensation to surviving students, and to appoint the Truth and Reconciliation Commission. As you know, we have I've directed Minister of Service Alberta, Minister of Indigenous Relations, to redouble efforts fully to implement calls to action 72 through 76 of the TRC report. And we'll be making a further announcement next week about Alberta's effort to work to support Indigenous communities in their efforts to find any lost graves in this province.
Just to follow up, am I on? Yeah, okay. But the draft curriculum that is currently being consulted on provincially, Mr. Champion was one of the key writers or consultants for the social studies curriculum. So Indigenous leaders, including AFN Regional Chief Marlene Poitras, say Alberta cannot accept any of that draft social studies curriculum given Mr. Champion's role and influence in it. This is in addition to critics who say that the draft is age inappropriate, excludes Indigenous, Francophone, LGBTQ, and Hindu perspectives, that the amount of material to teach is impractical, that resources to support some of this curriculum don't exist, and that no school board will offer to test it this year. So what feedback would you need to hear that would prompt you to take social studies back to the drawing board?
Well, I appreciate you reading an ATA press release there, Janet. I'll just say that with respect to Indigenous communities, the current curriculum, as I understand it, has approximately 34 references to Indigenous history. The proposed draft K-6 curriculum has about 330 references to Indigenous identity, history, and culture. So there is approximately a tenfold or 1,000% increase in Indigenous content in the curriculum. And if that is, I think a clear expression of Alberta's desire to be radically more inclusive in our future curriculum of the central role of Indigenous people in our history and in our current society. If there are further suggestions about how to improve those over 300 references to Indigenous history and identity, we're certainly open to that. I just got a briefing from Minister LaGrange about the very robust, ambitious engagement plan that the Department of Education will be rolling out to consult Indigenous communities, parents, teachers, subject matter experts, and others on revisions to the draft curriculum. With respect to, I'll point out, for example, that in the current curriculum, the one that was being taught under the previous NDP government, that Indian residential schools are not introduced as a subject matter until grade 10. Under the draft K-6 curriculum, that would happen in grade 5. But after there's been context given about the whole history of First Nations and it being taught in a sequential way so that young people can understand just how terrible the residential schools were by understanding the culture that they tried to destroy. In terms of, you just said that there's critics such as yourself say there's too much content, but then complain about not enough content in certain areas. For example, with respect to the Hindu community, there is currently zero content with respect to Hinduism in the current curriculum. There was zero reference to Hinduism in the draft curriculum of the previous government. In the K-6 draft curriculum that we have tabled, it is the first time ever that faiths that are newer and have smaller communities in Canada, like Hinduism, Buddhism, and Sikhism, are introduced as specific mandatory curriculum items in the world history, in the world religion section. So actually there is, the draft curriculum is far more pluralistic, and that I think perhaps is one of the reasons there is criticism about too much content. We're ambitious for kids to, most importantly, have stronger reading and writing skills, but also strong cultural and civic literacy. That's what the social studies curriculum aims to do, and we're looking forward to constructive input on how we can further improve it.
Who's going to teach it? You cut the education budget.
Actually, education budget's increased. Go ahead, Graham.
Mr. Premier, Graham Thompson, iPolitics. Looking ahead to the summer.
I thought you were CBC.
Well, I move around.
Back and forth, okay.
Alberta Views magazine as well, to plug in there. The Stampede's coming up, big event for the summer. The federal government, of course, has given permission for people to come from the U.S., the Cowboys participants to come in, take part in the Stampede, but the border will not reopen. The U.S. border is not going to reopen. The Prime Minister wants to get more people vaccinated in Canada. It won't open until July 21st at the earliest. What will that do in terms of reopening Alberta? The Stampede will be open, but Americans won't be allowed to travel here.
So first of all, yesterday we had a First Minister's meeting call with the Prime Minister and all the premiers, and I joined a number of premiers in calling for a faster, safe reopening of that border and a faster, safe protocol for welcoming international travelers. I noticed that a lot of countries, like France yesterday, many European countries, have this week announced protocols to permit people who have been fully vaccinated with approved vaccines to visit their countries. And so we are working with the federal government on a protocol for safe reopening because it's critical that we obviously take necessary precautions to prevent new cases and new variants from coming into the country. And for that reason, I would support a continued effective travel ban on foreign nationals coming directly from countries with outbreaks of variants of concern, like right now Brazil and India with P1 and B1617 variants. But as a general rule, I think most premiers believe that we can at some point in July begin receiving folks who have been double dosed, fully vaccinated, as long as they also do a PCR test either before arrival or upon arrival. And we will work with the federal government to accelerate that. But in terms of the Stampede, they're not expecting many out-of-province visitors this year. I think their projection is that 90% of the visitors to Stampede will be Albertans, given that, the uncertainty around travel. So they're not banking on a big tourism trade this year, but we do appreciate the Government of Canada responding to our request for a national interest exemption that had been endorsed by Dr. Hinshaw for 134, I believe, Stampede performers.
And on the, on the summer, what are your plans this summer? I know that looking at the opinion polls have shown your numbers have dropped in terms of popularity. Do you plan on touring the province, trying to reconnect with Albertans who might have lost faith with your government? Well,
I certainly plan on enjoying a great Alberta summer and getting out and reconnecting with people. It's been too long. A lot of relationships have we haven't been able to keep normal friendships alive by seeing people, and I'm just looking forward to reconnecting. First of all, with just friends and family, but then also getting around across the province, attending major events. And yeah, so we'll be having a pretty ambitious summer tour starting after Stampede. We'll be doing a kind of relaunch of Alberta's economic recovery plan towards the end of July. And we have already dozens of announcements lined up about new investments, new capital projects, job creation announcements across the province. So I'm going to be a pretty busy beaver over the summer, getting around every corner of the province, and I am so looking forward to it.
We'll just go to the phone for our next question. Operator, can you please put through our first caller?
Chris Barco, Calgary Herald.
Hi, this is a question for the Premier. Premier, aside from the restrictions on continuing care centers, will there be any COVID-19 restrictions or recommendations for specific industries? What are your expectations for businesses?
Well, as we approach July the 1st, I think that Dr. Hinshaw may be making some recommendations for example, limited mask use in certain contexts, like, for example, obviously long-term care, continuing care settings, hospitals. She may have some other workplaces where that is called for. So she and the Department of Health are working on a package in that respect. But as I say, the main focus will be on those healthcare settings. Apart from that, we would just ask employers right across the economy just to use good common sense. We need to accept the good news about the protective effect of vaccines. We need to accept that science. At the same time, as I said, we would encourage employers to maintain the good habits that we've all developed over the past year and a bit in terms of hand washing, encouraging their employees to stay home if they're feeling sick, where possible, providing them with compensation so they don't lose, because we don't want people coming to work if they're sick, and so we encourage employers to look at supporting employees when they have to stay home, and you know, monitoring people's health and symptoms, encouraging folks to get tested if they are symptomatic. So those are kind of the basic things that we'll be encouraging businesses. But we're not expecting, Tyler, you can supplement this, we're not expecting to be issuing a whole range of specific guidelines for various businesses. This is actually opening up because of the protective power of the vaccines.
Yeah, sure. Yeah, thank you for the question. I mean, it's similar to what we saw when we relaunched in 2020, when we had so many businesses who were apprehensive or anxious about how to, you know, take care of their patrons and their employees, and they asked us to be able to provide them with a lot of guidelines for them to be able to have a safe reopening in 2020. Same thing here. We're happy to be able to work with industries and answer their questions and provide that information through BizConnect as we did in 2020. So we'll continue to provide that feedback. But Premier is exactly right. This is about us now moving from a pandemic to an endemic, and being able to, each of us, look at, in a common sense way, of what the risks are to us, and for employers and individuals to be able to take those assessments and be able to make those decisions themselves.
Chris, do you have a follow-up question?
Yes, I do. For the Premier again, after 15 months of the messaging of trying to stop the spread, how is the government going to work to build confidence in the public to go back out and to return to normal activities on the business front and in terms of spending?
Well, I think that's exactly what we're doing here today. And we're going to have a celebration on Canada Day about our new openness, and encourage people to get out there and support those small businesses that have been so hard hit in the past 16 months. Do so with confidence. You know, don't live in fear. I know that some people are going to have a hard time getting used to getting back to normal, and some people may have reasons to be precautious if they are immunocompromised, or if for one reason or another they cannot or will not get vaccinated. I can understand those folks may be taking extra personal precautions. That makes sense. But we would just say, look, we paid the price. We paid the high and bitter price of protecting lives in our healthcare system for 16 long months. We now have the way out of this, which is the miracle of modern science of these vaccines. Embrace it. Say yes to the science. These vaccines, once you get like a second dose particularly of the mRNAs, we're talking 99% protection against severe outcomes. So it doesn't mean 100%. As I've said before, the virus will circulate, variants will emerge. The most contagious variants will become, over time, the dominant variants. People will get infected. Some people will get sick. Regrettably, a few people likely will pass away, as has been the case forever with the flu, with influenza. So, but we don't shut down society to deal with that kind of limited and controllable risk. We manage the risk. The vaccines give us a superpower to manage it. Let's embrace that. So I just encourage people, you know, we've all made sacrifices, but just think about those small businesses who have been, like many of them, shut down for months. So in some cases, I'm thinking of, well, some of the concert venues, event halls, nightclubs, some of those businesses have been shut for literally since March 16th of last year. So get out and support those folks. Many of them are on their last legs financially. And by the way, this is not just about 70% first dose coverage. We are leading the country on second dose. We're going to be hitting 25% second dose coverage by the end of this week. I think we'll be pushing 40% second dose full inoculation by around Canada Day. We are further ahead, and 15% of the population has natural immunity from prior infection, which is also pretty powerful. And the numbers keep ticking up. So our point is that we are going to be fully opening on Canada Day at a much higher level of epidemiological protection, of population protection, than anywhere else in the world that has opened up. Texas opened up completely on March the 6th, removed all public health restrictions after just for 15% first dose coverage. They've had huge public events. People have been living their normal lives for 3 months there, and many other U.S. states, as numbers have continued to decline. But we're going to beat them because instead of they've choked at 50% first dose coverage in the U.S., we're now exceeding 70%. So let's keep pushing that dial up, Albertans. That's the best tool to make sure that we avoid limited outbreaks and we never have to go back to restrictions. Sorry.
Go ahead, Bill.
Hi, Bill Fortier, CTV News. Nice to see you in person again, to both of you. I have to ask, you keep talking about leading the country in second doses, but when you look at first doses, we're well behind the average, behind by about 5% on first dosage. Yet other provinces are not coming anywhere close to what we're going to see on July 1st until August, even September. Doctors here, medical experts here, are telling us they think we're basically ushering in a fourth wave because of the Delta variant. And I just want to know how you respond to that, maybe both of you.
So a couple of points. First of all, we have, the three prairie provinces have a much younger population, so we have a larger share of people in our population who are not eligible for any dose, under 12. So it's about 19% of the population here that cannot get a vaccine versus only 14% in BC. So that's an important factor to consider. Secondly, in terms of other provinces, BC is going to their phase 3 on their reopening on Canada Day as well. And it's very similar to ours. I think the only difference is with respect to large events. Thirdly, like I've told you, look what's happened in the United States. How could American states open up at radically lower levels of vaccine coverage and have dropping infections, dropping cases, dropping hospitalizations? And how could we not experience the same thing at much higher levels of protection? With respect to the Delta or the B1617.2 variant, so it's been circulating in Alberta since, as best we know, April the 9th, so 9 weeks ago. We still have only about 200 active cases, less than 10% of our total active cases. And over half of those cases are in 2 local geographic areas out of about how many, 130 LGAs? 132 LGAs. So half the Delta cases are in 2, which means there has not been geographic spread. It's very localized. And finally, you know, at this stage of this, I don't think it's responsible constantly to be spreading fear. We need to embrace the science of the protective effect of vaccines. I've heard about CTV reports about that we're headed into the fourth wave, and some person on Twitter with their projections that we're going to be awash in Delta cases, forcing people into the hospitals. I don't think that report mentioned the Public Health England massive study of the Delta cases in in UK, which says that on the first dose, 14-day lag on the first dose of a mRNA vaccine is 96% protective against hospitalization, and a second dose 98% protective. So the data is in, the global experience is clear. This is one of the most cautious plans in the world that we have seen. And we'll keep an eye on that and other variants. I guarantee you, though, the promoters of fear will have lots of variants to come in the future. There will be new variants. They'll be more contagious. The scientists will study them. If necessary, the vaccines in the future will be adjusted to be more protective against future variants. But if other countries with lower levels of protection to get back to normal, why can't Alberta?
I can make one more point about the Delta, if that's right. I mean, just also point this out when it comes to this one particular variant, the Delta variant. That starting June 1st. So when it comes to testing for a variant, as we've seen other variant strains, there are a couple ways you could do it. There's one by doing full sequencing of the genome, which is very difficult, expensive, timely. But APL, our public lab system, has been able to develop throughout this various tests to make it a little bit quicker for us to do. Starting June 1st, we've been able to test 100% of our positive cases for that particular variant. It is, today it was 100 new positive cases. So the amount of Delta cases right now is, as Dr. Hinshaw has made the point to me, this is her advice, that it's still statistically irrelevant. For us to be able to make the types of claims that we've seen in the media about the Delta variant, when the number of new cases we have and the full testing we're doing and catching and doing the contact tracing for those new Delta variants is right now not statistically relevant. So obviously we're going to continue to have a focus on, as we would with all infectious diseases, to have our contact tracers being able to contain that variant in particular. It will, as we know, become a dominant strain here in Alberta, but dominant strain of a set of cases that is continuing to come down throughout the province.
Sure. One more thing, because I know there's been a lot of attention paid to two unfortunate deaths in Calgary hospitals of people who had been vaccinated and had contracted the Delta variant. So these were both individuals in their 80s with multiple comorbidities, both of whom were in hospital before contracting COVID, both of whom were, I understand, severely immunocompromised. Our condolences go to their families, but we should understand, as I said, 98% protection against hospitalization from the Delta variant is not 100%. Very elderly, very frail, immunocompromised people with multiple comorbidities are going to continue to be vulnerable to any kind of disease like this.
Very quick follow-up, because I got a long answer on that.
Sorry, but I apologize.
No, not at all. There's still over 1.7 million Albertans, including, of course, under 12, who are unvaccinated. Is there a contingency plan? Is there a plan B if we reopen and we see the hospital numbers start to increase again? We see the R value start to increase again. Is it possible that the province has to pull back on the reopening, or is this in place permanently?
We just don't see that scenario. This, as I said, our intention, this is open for good, not just open for summer. We will have to, from time to time, address localized outbreaks. And I fully expect that we'll see an increase in cases, particularly with the typical seasonal wave for contagious diseases of this nature, probably starting mid-October. But by then, I'm very confident that we will be at 75% of the population fully vaccinated. And it's possible that between now and then, there will be successful trials for the use of these vaccines in the under 12 population. So it's quite possible that by the time schools reopen, that vaccines will be open to school-age children. and that we could increase the overall share of population that have been vaccinated. So COVID will continue to be here. Care and precaution common sense is needed, and if we see any completely unforeseen circumstances, we'll respond to those in due course. But again, this is not a guess. This plan is based on the expert analysis of the Chief Medical Officer, our public health team, looking at global experience and looking at the science of vaccines.
We have time for probably 2 more questions, so we'll do last one on site and then we'll take one more on the phones.
Darcy Ropchan, City News. I have a question and a follow-up for both the Premier and the Minister. You two folks, I believe your first vaccine was AstraZeneca. Do you have any concerns as we hear reports about some countries not accepting the AZ vaccine for travel? And are there any plans to get extra mRNA doses to folks who want them to travel?
It's a good question. It's true that some jurisdictions are saying that they'll only permit travel or certain activities. I saw Broadway theaters will only accept people coming in if they have been fully vaccinated with a U.S. approved vaccine. You're right, AstraZeneca has not been approved in the U.S. We're not expecting the U.S. to impose that as a travel requirement, but it may be a requirement in particular situations like theaters in New York. It may be a requirement in some European countries that have not approved AstraZeneca. In that case, we are working, first of all, with the federal government on a system to provide either paper or electronic confirmation of vaccination status to facilitate people who want to travel. And how we indicate which vaccines people have received, I don't yet know. Tyler, do you have a comment on that?
Sure. I think the most important thing to say in response to that is to make sure that people understand that all of the approved vaccines are safe and effective, and that people have a choice here in Alberta. So obviously, we know from our allotment tables from the federal government up until the end of July that when it comes to Pfizer, which has been stable and predictable since mid-April, as well as the 650,000 that we've got coming from Moderna, that we have a lot of messenger RNA. We'll be encouraging people to consider what is the first available vaccine to them. And so because of that availability for messenger RNA, that people who can consider the consequences of whether it is, for example, what the theaters in the U.S. might be doing, they can consider that as well in their decision. But people here in Alberta have a choice, and all the vaccines that are approved are safe and effective.
And my next question is for Premier Kenney. The Al Rashid Mosque here in Edmonton sent you a letter yesterday asking for more to be done to address racism in the curriculum, which you mentioned earlier. There's also calls for politicians to acknowledge when their past words have promoted hatred or harm. Do you have a response to that, particularly in relation to the niqab ban at citizenship ceremonies as your time as immigration minister?
So on the first point, we have, as I said, significantly increased content in the draft K-6 curriculum about, for example, world religions and the diversity of Alberta. There's radically more content, for example, about the contribution not just of Indigenous people, but Black Albertans of all different faith and ethnocultural minorities. There is, for the first time, significant content about Islam, together with Judaism and other world religions, in the draft elementary school curriculum. And there's also, for the first time, significant content about historical injustices, discrimination, unjust discrimination targeting minority communities in Canada, like wartime internment measures and unjust immigration restrictions, for example. I've addressed the question of the citizenship ceremonies. I have always opposed niqab bans. I've always said that I don't think the government has any business regulating what people wear. But I also think it's reasonable that when somebody's taking a public oath in a court, that for those few seconds they do so publicly with their face uncovered, just as they would in taking a passport photo or a driver's license picture, or being identified before boarding an airplane, or testifying in a court of law. I think there are those there particular moments when it's quite reasonable to ask that people engage publicly with their identity visible. But I don't think it can be characterized as a ban to ask people for 10 seconds while they're taking an oath in a court to do so with their faces uncovered. I think it's a reasonable request. I think reasonable people can disagree about that. But my track record in working with Canada's Muslim community is very clear. I was a Minister of Immigration who welcomed over 150,000 Muslims as new Canadians. I was a Minister of Immigration who welcomed Muslim refugees from genocide, including the Rohingya people and Uyghurs from China. I was as a Minister of Multiculturalism, threatened to sue the PQ government of Quebec for its proposed Charter of Quebec values that would ban anyone from delivering or receiving public services with an ostensible religious symbol, so not just niqabs, but also hijabs and turbans and the like. I would note finally that when I announced the policy with respect to taking the citizenship oath publicly, that I did it at the behest of a Muslim women's group I met with in Montreal, and I was given an award by the Association of Progressive Canadian Muslims for that policy. So again, I think that reasonable people can have different views on that.
And we'll just go to the phones for our last question. Operator, can you please put through our last caller?
Adrian Williams, CBC French.
Hi, my question is for Premier Kenney in French. I have two questions. On a parlé à des experts qui disent que c'est trop tôt pour lever toutes les restrictions aussi rapidement que vous prévoyez le faire le 1er juillet. Ils aimeraient que ce soit un petit peu plus graduel parce qu'ils ont peur, entre autres, qu'on laisse la porte ouverte aux variants Delta. J'aimerais savoir ce que vous en pensez.
Sure, I'll just kind of translate that for folks who are listening. That was essentially, in French, the CTV question about whether we're opening too quickly. Écoutez, notre plan est axé sur un niveau de protection de la population beaucoup plus élevé que n'importe quelle autre juridiction au monde qui ont déjà ouvert. Au Texas, par exemple, ça fait 3 mois. Ils ont éliminé toutes les restrictions de santé publique et les nombres des cas des hospitalisations de COVID-19 ont diminué depuis ce moment-là. Et ça a été, à ce moment-là, Texas avait seulement 15% de la population avec une première dose du vaccin. Alors, nous parlons aujourd'hui de 70% et ça augmente quotidiennement. Par la fin de juin, je crois que nous aurons presque 40% de la population entièrement vaccinée avec la 2e dose. Alors, on est confiant. Ce plan a été développé par le Dr. Hinshaw et notre équipe des experts de santé publique. Et c'est axé sur l'efficacité des vaccins. Une étude publiée au Royaume-Uni cette semaine indique que la première dose d'un vaccin protège ceux qui sont protège les gens, 96% des gens de l'hospitalisation. Alors, nous sommes très confiants dans le pouvoir de protection des vaccins. And I just that was the same answer more or less I gave in English.
And your follow-up question, Andrea?
Merci.
C'est moi qui vous remercie. Okay, go ahead.
It's in French, and the question has been asked before in English, so I'll ask it in French. Donc, c'est concernant les propos de Chris Champion, qui remet en doute le génocide culturel contre les Autochtones dans les pensionnats. Il était aussi un conseiller pour votre programme scolaire. J'aimerais vous entendre par rapport à ces propos.
Non, je ne suis pas d'accord. Je souligne que nous ne voulons pas utiliser l'Holocauste des Juifs de l'Europe comme un analogue pour les autres expériences parce qu'il y a vraiment quelque chose de unique dans l'expérience du peuple juif de l'Europe avec le meurtre de 6 millions juifs comme une politique délibérée de l'État fasciste. Alors, j'espère que nous pouvons, en parlant de les autres grandes injustices historiques, je crois que c'est prudent d'éviter les efforts de diminuer la nature unique de l'Holocauste. Cela étant dit, je suis depuis toujours très clair que le système des écoles résidentielles pour les Autochtones au Canada était une grande mal. C'était épouvantable. C'était un crime contre les familles. C'était une des grandes injustices dans l'histoire canadienne. C'est la raison pour laquelle je suis heureux que le Premier ministre Harper s'est excusé pour le Canada pour ce système terrible et donné la compensation aux survivants et a nommé la Commission de vérité et réconciliation. Nous faisons nos propres efforts ici. La semaine prochaine, par exemple, nous aurons une annonce en ce qui concerne l'aide pour les communautés autochtones à découvrir les autres cimetières des étudiants des peuples autochtones qui ont été perdus. Alors, il faut que tout le monde soit axé sur l'esprit de réconciliation maintenant.
That's all our time today. Thanks for joining us.
Thank you very much, everyone. Thank you. All right.